Diabetic retinopathy is a complication of diabetes that affects the retina, the light-sensitive tissue at the back of the eye. It occurs when high blood sugar levels cause damage to the blood vessels in the retina, leading to vision problems and, in severe cases, blindness. Diabetic retinopathy is one of the leading causes of vision impairment in adults, particularly among people with uncontrolled or long-term diabetes. Stages of diabetic retinopathy. Diabetic retinopathy progresses through several stages, each with increasing severity. Mild non-proliferative diabetic retinopathy. This is the earliest stage and is often asymptomatic. Small areas of swelling, microaneurysms, develop in the retinal blood vessels, which may leak fluid into the retina. Moderate non-proliferative diabetic retinopathy. As the condition progresses, some of the blood vessels that nourish the retina become blocked, leading to reduced blood flow. Leakage of fluid and blood continues, causing retinal swelling and damage. Severe non-proliferative diabetic retinopathy. More blood vessels become blocked, depriving larger areas of the retina of nourishment. The retina sends signals to the body to grow new blood vessels, neovascularization, as compensation for the lack of blood supply. Proliferative diabetic retinopathy (PDR). This is the most advanced stage. New, abnormal blood vessels form on the surface of the retina. These vessels are fragile and can rupture, leading to bleeding into the eye, vitreous hemorrhage. Scar tissue may form, which can lead to retinal detachment, the retina pulling away from the back of the eye, causing severe vision loss or blindness. Symptoms of diabetic retinopathy in the early stages. Diabetic retinopathy may not cause any noticeable symptoms. As the condition progresses, symptoms may include blurred or distorted vision, floaters, spots or dark strings that float in your vision, difficulty seeing in low light, sudden vision loss, dark or empty areas in the vision field. Since symptoms often do not appear until significant damage has occurred, regular eye examinations are crucial for people with diabetes. Causes and risk factors. Diabetic retinopathy is caused by damage to the small blood vessels in the retina due to chronic high blood sugar levels. Several factors can increase the risk of developing diabetic retinopathy. Duration of diabetes. The longer a person has diabetes, the higher their risk of developing diabetic retinopathy. Both type 1 and type 2 diabetes can lead to this condition. Poor blood sugar control. Consistently high blood glucose levels increase the risk of retinopathy. High blood pressure. Hypertension. High blood pressure can exacerbate damage to the blood vessels in the retina. High cholesterol. High levels of LDL cholesterol can increase the risk of retinopathy. Pregnancy. Women with diabetes who become pregnant may experience a worsening of retinopathy. Smoking. Smoking can increase the risk of diabetic complications, including retinopathy. Kidney disease. Diabetic nephropathy. Kidney disease can also increase the risk of diabetic retinopathy. Diagnosis of diabetic retinopathy. To diagnose diabetic retinopathy, an eye care specialist will perform a comprehensive eye exam that includes dilated eye exam. Eye drops are used to dilate the pupils, allowing the doctor to examine the retina for signs of abnormal blood vessels, swelling, bleeding, or scar tissue. Optical coherence tomography. October. This imaging test provides cross-sectional images of the retina, helping to detect fluid buildup and retinal swelling. Fluorescein angiography. A dye is injected into a vein in the arm, and photographs are taken as the dye circulates through the blood vessels in the eye. This test helps to identify blood vessel leaks, blockages, or abnormal growth. Treatment of diabetic retinopathy. Treatment for diabetic retinopathy depends on the severity of the condition. The goal is to stop or slow the progression of the disease, preserve vision, and prevent complications. Early stages. Non-proliferative retinopathy. In the early stages, regular monitoring and good blood sugar control are often sufficient to prevent further damage. This includes managing blood pressure and cholesterol levels. Advanced stages: proliferative retinopathy or macular edema. Laser treatment. Photocoagulation. A laser is used to seal or shrink abnormal blood vessels, preventing further bleeding and retinal detachment. This can be effective in treating proliferative retinopathy. Vitrectomy. In cases where bleeding has occurred inside the eye, vitreous hemorrhage, or when there is a risk of retinal detachment, a vitrectomy may be performed. This surgery removes the blood and scar tissue from the vitreous, the gel-like substance inside the eye. Anti-VEGF injections. VEGF, vascular endothelial growth factor, is a protein that promotes the growth of abnormal blood vessels in proliferative retinopathy. Anti-VEGF medications, such as bevacizumab, Avastin, ranibizumab, Lucentis, or aflibercept Gilead, are injected into the eye to block VEGF and reduce abnormal blood vessel growth. Corticosteroid injections. In some cases, steroids may be injected into the eye to reduce inflammation and swelling in the retina, particularly in diabetic macular edema (DME), a complication where fluid builds up in the macula, the central part of the retina responsible for sharp vision. Prevention of diabetic retinopathy. While diabetic retinopathy may not always be preventable, individuals with diabetes can reduce their risk and slow the progression by managing blood sugar. Keeping blood glucose levels within target ranges helps prevent damage to the blood vessels in the retina. Controlling blood pressure and cholesterol. High blood pressure and cholesterol can exacerbate the effects of diabetic retinopathy, so managing these is important. Regular eye exams. People with diabetes should have a comprehensive dilated eye exam at least once a year, even if they have no vision problems. Early detection of diabetic retinopathy is crucial for effective treatment. Avoid smoking. Smoking increases the risk of diabetic complications, including retinopathy, so quitting smoking is highly recommended. Maintaining a healthy lifestyle, a balanced diet, regular exercise, and maintaining a healthy weight can help control diabetes and reduce the risk of complications. Complications of diabetic retinopathy. If left untreated, diabetic retinopathy can lead to serious vision problems and complications, such as diabetic macular edema (DME), swelling in the macula, leading to vision loss in the central part of the field of vision. Vitreous hemorrhage. Bleeding into the jelly-like fluid that fills the center of the eye vitreous, which can cause sudden vision loss. Retinal detachment. Scar tissue caused by proliferative retinopathy can pull the retina away from the back of the eye, leading to severe vision loss or blindness. Blindness. Untreated diabetic retinopathy can eventually lead to permanent vision loss. Living with diabetic retinopathy. Managing diabetic retinopathy involves a combination of controlling blood sugar levels and following up regularly with an eye care specialist. Many people with early-stage diabetic retinopathy do not experience symptoms and can prevent progression by maintaining good control of their diabetes. For those with more advanced stages, timely treatment can often preserve vision and prevent further complications. Conclusion: diabetic retinopathy is a serious but manageable complication of diabetes. Early detection through regular eye exams and careful control of blood sugar, blood pressure, and cholesterol are key to preventing its progression. For those with advanced retinopathy, modern treatments like laser therapy and anti-VEGF injections offer effective ways to preserve vision.